Today we are discussing about arteriosclerosis and atherosclerosis. Introduction. Cardiovascular disease. Cardiovascular disease, also called heart disease. Heart condition that include diseased vessels, structural problems and blood clots. Coronary artery disease, high blood pressure, cardiac arrest, congestive heart failure, peripheral artery disease, stroke, etc. are the cardiovascular disease. Arteriosclerosis and atherosclerosis. The buildup of fats, cholesterol, and other substance in and on the artery walls are called arteriosclerosis and atherosclerosis. Arteriosclerosis. Arteriosclerosis is the thickening and hardening of the walls and the narrowing of the lumen of medium sized arteries, leading to the loss of their elasticity and flexibility. It may occur as a natural change in old age, however, in some persons it occurs much earlier in life, sometimes during childhood. Arteriosclerosis results from the excessive deposition of lipids, calcium, and hyaline. The arterial wall becomes thick and non-elastic, and the arterial lumen becomes narrow. So the blood flow through the affected artery becomes very slow or even blocked. This burdens the heart to exert itself more than normal to pump blood to the extremities of the body. This puts much strain on the heart. Usually, arteriosclerosis produces no symptoms when it occurs in arteries other than cerebral, coronary, and renal arteries. However, arteriosclerosis in cerebral artery may cause cerebrovascular accident, commonly called stroke or paralytic attack. Coronary arteriosclerosis may result in coronary thrombosis, angina pectoris, heart attack, etc. Renal arteriosclerosis may cause glomerulonephritis and renal failure. Arteriosclerosis in the arteries to the legs very rarely cause gangrene. The exact cause of arteriosclerosis is not definitely known. Hereditary factors, hypertension, diabetes mellitus, etc. are suspected to cause arteriosclerosis. Atherosclerosis. Atherosclerosis is an extreme or acute form of arteriosclerosis. It is characterized by a degenerative condition of the arterial wall called atheroma. In it, the arterial wall becomes abnormally thick, hard, non-elastic and brittle with a high deposition of cholesterol and other lipids in the form of plaques and knots. As these plaques enlarge and the arterial wall thickens abnormally and the arterial lumen becomes extremely narrow. So only very small quantity of blood flows to the part or tissue to which the affected artery goes. As a result, that part becomes ischemic. This in turn leads to extensive tissue destruction. Very often the atheromatic part of the arterial wall ruptures, causing hemorrhage and thrombosis. This is a fatal condition. Cerebral atherosclerosis often lead to cerebrovascular accident. Coronary atherosclerosis may cause ischemic heart disease such as angina pectoris, and renal atherosclerosis may cause glomerulonephritis. Some of the suspected cause of atherosclerosis are high blood cholesterol level, hypertension, sugar diabetes, smoking, etc. Old age, obesity, lack of exercise, emotional stresses, hereditary diseases, etc. are believed to contributing factors. This disease is more common among men than among women. Conclusion. Reason for atherosclerosis and arteriosclerosis: high blood pressure, high cholesterol, high triglyceride, a type of fat in the blood, smoking or chewing tobacco, diabetes, insulin resistance, obesity, inflammation from an unknown cause or from disease such as arthritis, lupus, inflammatory bowel disease. Prevention. A healthy diet, losing weight, being physically active, and not smoking can help reduce your risk of atherosclerosis and arteriosclerosis. A healthy diet includes fruit, vegetable, whole grain, lean meat, skinless chicken, seafood, and fat-free or low-fat dairy products. This is all about arteriosclerosis and atherosclerosis. Thank you.